Swallowing is one of the most complex interactions in the human body. A swallowing problem, otherwise known as dysphagia, is divided into phases. The oral phase of swallowing involves chewing, breaking down a food, and transporting the food to the back of the mouth to prepare for the swallow. The pharyngeal phase of swallowing involves the transport of food into the esophagus and then into the stomach. Many different problems can arise during each phase of the swallow, resulting in dysphagia. This video is designed to assist you as a caregiver with insight regarding what to look for to determine whether your patient has swallowing difficulties. The exact prevalence of dysphagia is unknown. Recent studies, however, indicate that the prevalence may be as high as 22% in people over the age of 50 and as high as 75% in nursing home residents. Approximately 10 million Americans are evaluated each year with swallowing difficulties. Swallowing difficulties negatively impact quality of life, weight, skin integrity, and overall health and well-being. The following are signs and symptoms of dysphagia that you may observe during food or liquid consumption. Food loss from the mouth. This can occur when a patient removes food from a utensil, during the chewing process, or after he or she swallows. Unable or difficulty chewing. This can be observed when a patient does not have adequate dentition or the oral motor strength or coordination to break down food. Pocketing of food in sides of mouth. Food can be observed in the crevices between the teeth and cheeks. It's important to note that the patient may be unaware of this and will need to be cued to remove the residue with either his or her tongue or finger. Trouble moving food through mouth. Oral residue. This would look like bits of food left in the mouth after a swallow. It's important to note that the resident is unaware of this and will need to be cued to remove the residue by attempting an additional swallow or by taking a sip of liquid. Delayed swallow. A normal swallow typically takes 1 second to complete. In the aging population, this swallow time slows. In patients with dysphagia, muscle weakness, along with reaction time, can cause the swallow to delay even further, creating an increased risk for aspiration. The easiest way to look for a swallow is to watch the Adam's apple. It will move up and forward when the patient swallows. If this is not observed timely, it can be identified as a delayed swallow. Effortful swallow. If the patient appears to be exerting more energy during the swallow process, this is noted as an effortful swallow. Repetitive swallowing of single bites. Some patients may require several swallows to clear all of the food from the oral or laryngeal cavity. This can be caused by muscle weakness or incoordination. Coughs before, during, or after the swallow. Throat clearing during or after the swallow. Gurgly vocal quality after the swallow. This wet vocal quality can be a result of food or liquid particles sitting on the vocal folds and is an indicator that food or liquid may be aspirated. Gagging or drooling. Refusal to eat. If swallowing is an unpleasant, painful, or scary experience, residents may not choose to eat at all. Unexplained weight loss. If a patient is refusing to eat or is exerting more energy during the eating process, weight loss may occur. Watery eyes or runny nose. It is common for staff to assume that when a patient has watery eyes or a runny nose, it is solely due to allergies. If these symptoms occur only during or after food or liquid consumption, it is a likely sign of aspiration. Temperature spikes. An increase in the patient's temperature after the meal may indicate aspiration. Drop in O2. A drop in O2 levels typically occurs directly after the swallow if the patient has dysphagia. If you identify any of these signs and symptoms of aspiration, please notify the nurse and your speech-language pathologist.